Hi, welcome back to my channel. This is Still Curious with Gary Green, and I am Gary Green. I had atrial fibrillation. I had seen at least 4 cardiologists who prescribed medication that I was on for years, and every one of them told me that I should have an ablation. Instead, I chose a procedure that none of these doctors had ever heard about. And that's what I want to talk to you about. I hope that doesn't sound too dramatic, but it's a fact. It sounds dramatic to me when I say it, but if you stay tuned and listen, you're going to discover things that I discovered and truly changed my life. I'll start at the beginning. I was 62 years old, and during a routine physical exam with my primary care physician, he did an EKG and said, "You're in atrial fibrillation." Never heard that word, especially reference to me. And he suggested I go over to the hospital. His office was right next to the hospital. He suggested I go over to, not suggested, he ordered me to go over to the hospital and check myself in and get this taken care of. Wow, what a shock. And I did what he said, doctor's orders, you know. I checked myself into the hospital and spent the next couple of days there going through tests, you know, stress tests and echocardiograms, doing all this sort of stuff, make sure my heart was functioning, and it was functioning fine, except I had a arrhythmia problem. The atrial fibrillation would come and go, and it didn't seem to bother me too much, but I got out of the hospital and I was, you know, on my way to a cardiologist to see how my heart was doing. Well, I was on blood pressure medicine, and the cardiologist that I went to prescribed arrhythmia medicines that has something to do with blood pressure. But let me tell you, folks, those things almost killed me. You've heard stories about taking drugs for one thing and it does this other thing. Well, I actually had 2 occasions when I was trying different medications where I fainted or passed out. I never went completely out, but it was the medication. It wasn't my atrial fib, because I never passed out before. It was the medication. They were trying to control my heart. Fortunately, I was home when I went out the first time, and then the second time I was in a public place, but fortunately it was a church. So I got help right away, got transported to the hospital both times, and results, yeah, you got atrial fibrillation, you should have, or a catheter ablation. Well, this was just the beginning of my journey. The medications, the blood pressure issues. I did learn that my atrial fib burden, Afib burden, was about 15%. I wore a monitor that determined that my heart was out of rhythm about 15% of the time. When I saw the cardiologist, I wasn't an Afib, so they knew I had it, but I just wasn't in it when I saw him. So maybe the medication was working. And I just lived with it. I don't know how long I had it before it was diagnosed, but I probably had it possibly for years. But once it's diagnosed, that's when my journey really began and started seeking treatment. But that treatment that I was recommended was going to an electrophysiologist, not a cardiologist. An electrophysiologist performs a catheter ablation. And I hesitated with that. One of the first cardiologists I talked to was when I was in the hospital. He said, "Afib is not going to kill you." That was reassuring. He said, "And it's always better to take care of an issue like this on the outside." Very interesting what he said. Now, he was referencing my weight. I was overweight, still overweight, a little less than I was at this time. But he said, treat it with medication and not do anything to the heart. Also, while I was in the hospital, this is my decision making why I didn't refuse, or why I've refused ablations. There was a guy in the bed next to me that was just having his second ablation. He already had one. I'm learning now that ablations are 50 to 70% success, for lack of a better term. or there's a 50 to 70% chance that your atrial fib will not reoccur when you have a catheter ablation. Well, every cardiologist I went to, they almost got, I think, disgusted with me because I'm coming to them and I'm not getting an ablation. But I switched to another cardiologist that I really was comfortable with. I could talk to him very easily, really liked him. He knew I had AFib, but he recommended an ablation, but I never had one. But here was what really kicked my journey into high gear. This is in 2013. So I started in 23. In 2023, I went to this cardiologist that I liked, and I was an AFib at the time. And he said, Gary, you really have got to get an ablation. Plus, I see you just turned 70 years of age, or 72 might have been. Your CHA2DS2-VASc score now indicates you should be on blood thinners. CHA2DS2-VASc score, I'm not going to get into that. It's something I learned about. It's a measuring tool that doctors use to determine whether blood thinners are needed. And so what I was told that one day I didn't need blood thinners, but the day after my birthday I needed to go on blood thinners. He gave me a whole bunch of samples. They're expensive as heck, even with insurance. He gave me the samples. I left. He said, get an ablation and get on these blood thinners. Well, I refused to do both. I just thought maybe it was risky. Maybe I was dumb. Yeah, some people might think I'm dumb for not doing this because I could have a stroke. Well, what I learned is that the blood thinners reduce your chance of stroke, but doesn't eliminate it. And I know medicine doesn't always eliminate everything, but I thought it reduced it by 50% or some number like that. It was like, yeah, that means I can still have a stroke while I'm on blood thinners, and I can have a stroke when I'm not on blood thinners. And I heard that strokes while you're on blood thinners is very dangerous because of the bleeding that occurs. So I said, okay, if I'm going to have a stroke, I want to have a stroke when I'm not on blood thinners. So I kept asking questions. The ablation, as I studied the catheter ablation, I knew that they went up and threaded the camera and the tool up there to burn, basically. Burn, cold, or sound. They've used 3 different methods to try to pinpoint where the nerves are on the inside of the heart. And they burn these little spots. And of course, when you burn muscle, it's killed. But they don't always get it. But the upside is you go in the morning and you're home in the afternoon. There's no surgery involved in this. So I really, after Dr. Simon wanted to have me on the blood thinners and wanted me to get an ablation, and he actually called me at home a few weeks or a month after he had referred me to this electrophysiologist, the EP, and I said, I haven't done it yet. I don't know if I'm going to do it. So my procedure that I just went through and everything, it really got me thinking. So I went really deep into research mode. I said, there's got to be an answer to this. And so I got on YouTube, I Googled things, and everybody on YouTube, there's tons of information about AFib and what to do and all this other, just doctors. It was mostly doctors. There weren't very many patient videos. But I came across a doctor named Dr. Randall Wolf. He's a Houston Methodist Medical Center in the DeBakey Heart Institute. And he had a video that was, a presentation he was making to other physicians about his procedure. At the time, it was called the Wolf Mini Maze. After him, it's called Wolf Mini Maze. I learned about it. And it's minimal. I heard that it was surgery and it was minimally invasive. But when I heard that it's basically a one and done procedure, and he's got like 98% effective or cure, however you want to call it, that it doesn't come back for his patients. And he's been doing it for like 20 years. So yes, I was skeptical. Can this be real? Is this an experimental procedure? And I actually took a few days before I told my wife. I said, honey, I want you to watch this guy and you tell me what you think. Don't Watch the whole thing before you decide. And she watched it, open mind, thought, man, this might be something to consider. So after we discussed it a little while, about a week or so passed, and I'm on his website, Dr. Wolf's website, which I'll link here for you guys watching this. And I sent him an email, said I was interested in proceeding. He's in Houston, Texas, and I'm in South Florida. The next day, I got a reply saying, provide such and such information, and we'll get a virtual visit with Dr. Wolf and see if you're a candidate for this procedure. Another month goes by, I get contacted, and I'm given a date to have a virtual visit with Dr. Wolf. After that visit, it appears that I'm a candidate for his procedure because he had the information, some of my medical records I had sent him, and another few weeks goes by and I got notice that I was scheduled for his procedure 11 months out. Oof. But let me say right here, he's gotten much quicker. His patients now only have to wait a couple months, not 11 months like I had to. But I'm here to tell you, the waiting, I don't know, I'm post Wolf procedure. So let me get back to the story and tell you, I decided to do it. My insurance covered the procedure, which is a good thing. It did not cover the hotel that I had to stay in, and my wife had to stay in for the 8 days that we were in Houston, 3 days in the hospital, and then I had to see him when I was out of the hospital, but we stayed around Houston in the hospital. But we made the commitment to go. Now, between the time I got the appointment and before I had the surgery, I went back to my cardiologist and told him I wasn't going to get an ablation. I told him about it, and he had never heard about this procedure. But he wrote it down, and he was going to investigate. I told my primary care physician what I was going to do when I had my physical with him. He'd never heard of it. There's 2 other doctors I was seeing that I haven't mentioned to you, but because I was on this medicine called amiodarone for my heart rhythm, that I'd been on it for like 7 years, I had to go to a pulmonologist and a ophthalmologist because the medicine I was taking, the amiodarone, as effective as it was, it could cause damage to my lungs and my eyes, my vision. So I'm seeing 2 other physicians because of the pill I'm on. So when I went to see them, I said, I'm going to be off this pill. I'm not going to have to come see you again. And sure enough, I informed them, and they looked it up. When I was in the examining room, they wrote it down. The ophthalmologist and the pulmonologist actually pulled up Dr. Wolf's website while I was in the examining room with them. And this is so weird. I mean, it's like I'm educating the medical profession. Well, anyway, let me continue. So my surgery was about a year away, 11 months away. But let me just touch on the ablation, the 50 to 70% effectiveness versus 98% one and done. I knew going in that the Wolf procedure was going to require 3 days of hospital. It was going to be a surgical procedure, not opening the chest and putting his hands around my heart or anything. The procedure is done through both sides of the chest wall. So kind of the downside. But the hospital stay, surgery, where the ablation is, 1 day it takes you home, that sort of thing. But I was going to get my left atrial appendage clamped while Dr. Wolf was doing the procedure on the outside of the heart. And by the way, the nerves to the heart are on the outside, not on the inside. The ablation burns the inside of the heart to try to get the nerves on the outside. Dr. Wolf instead isolates the pulmonary veins, or the veins around the pulmonary arteries, pulmonary veins, and that's how he he isolates those nerves that cuts off the AFib. Besides doing that, he clamps this left atrial appendage, the LAA, which is the source for blood clotting. You know, when you have rhythm problems, your heart doesn't pump smoothly and blood doesn't pump smoothly. It stagnates or it lays still. It clots. That's what blood does. And so the left atrial appendage is a little sac that you don't really have any, it doesn't have any function for you anymore. It's kind of like the appendix. The blood will pool in this little sac and clot, and then your heart gets back in rhythm. The clots blow out and get into your veins, and that's what causes a stroke. Dr. Wolf clamps this. Not one of his patients after he performs this procedure are on blood thinners. I take the one and done and the stroke risk practically eliminated. I'll take the 3 days of stay in the hospital and a few weeks recovery. I'll take that over multiple ablations, that sort of thing. So let me wrap this up pretty quick. So where am I today? I don't take my amiodarone, my drugs. I never was on blood thinners. I have a better quality of life. I probably have more energy, not probably, I think I have more energy than I did. It's like reverse aging. I thought I was getting old and getting tired, and this is one thing I've told everybody that I've been able to talk to about this, is this. After the procedure, after the Wolf procedure, I didn't realize how bad I was with what my AFib was doing to me. I felt it. It was uncomfortable. I didn't think it was affecting my life, but it was. I truly have more energy. And this is like, if Fran was sitting here with me, she remembers who is this guy? You know, just had more energy. And so that the quality of life has been tremendous. Let me end with this. Make sure you know that I'm not saying everybody needs to have this procedure. This is not medical advice. I'm sharing an experience that I went through that I'm very grateful for. And if you're facing any kind of medical decision, do your research, do your homework, ask questions. Don't be afraid to ask for another opinion. That's exactly what I did. And fortunately, all my physicians involved in this were very understanding, which is important, that you have a decent, good relationship with a physician of yours. And then in closing, if you've been diagnosed with AFib or you've been trying to decide between treatments, could be you. It was like I was watching something like this. Leave me a comment. Tell me what questions you have. And if some of you want more details, I can always do an additional video covering the research and what my recovery was like. It's really, I hesitate and sometimes using the word miracles, but truly is a miracle. I'm reverse aged by getting this done. Thank you for watching. I'm real excited about my channel, and I'm glad you joined me, and we'll see you on the next one. Thanks.